Mr. Pelkey, it's a real honor to be involved and to meet you.
Thank you. Yeah. Quite a few years ago, I lost my sister. My
I'm
sister,
sorry.
my younger sister, and she had a really debilitating liver disease. The doctors were trying to treat her with uh, with cirrhosis of the liver for years, and she ended up being hospitalized and down towards the end, they had a specialist come out from Toronto to look at her, and he diagnosed this with this specific liver disease that was striking First Nations women, and but I was never sure of what the name of that disease was, but he was telling our family that this was a treatable disease, that it was entirely treatable, but that my sister was too far gone for it to make any difference for her. So that the disease eventually took her, and it was heartbreaking for us to lose her, but more heartbreaking to know that she didn't have to die. That it could have been treated if it was diagnosed early enough.
Yes.
Yeah. So we understood that you have done a lot of research into this area, and that's what we're hoping to talk to you about.
Oh, it would. I mean, it's entirely a privilege and honor for me to talk about this.
Yeah, yeah. And the name of the disease?
Um, in regards to your sister's situation and
Yeah,
the situation of many of the indigenous uh, community, there are two diseases which are autoimmune in nature. There are two in particular. One is primary biliary cholangitis, or what we call PBC, where the immune system attacks the very tiny bile ducts within the liver, um, and kind of causes scarring, which results in cirrhosis, which then results in, after many years, and sometimes not even many years, it can result in liver failure. And unless rescued by a liver transplant, patients will die prematurely. The other is a related disease called autoimmune hepatitis, where the immune system just basically attacks the cells of the liver. The pattern of liver injury in terms of liver biochemical abnormalities or what we see under the microscope in a liver biopsy are slightly different, but the end result is the same. It causes cirrhosis, and if that carries on, then it can cause liver failure and premature death unless rescued by a transplant. Both diseases, if diagnosed early, well before there's liver failure from cirrhosis, can rectify the situation, help patients prolong their lives, and even in some cases cause reversal of the process.
hmm yeah, yeah, yeah. I have one aunt that is still alive, and she was diagnosed properly, and but she tells me that she's on these medications for the rest of her life. So she was one of the lucky ones that they caught in time. So she's still living a productive life.
Well, that's excellent. I will make a comment. You mentioned your sister and your aunt, and
Yeah,
both autoimmune hepatitis and primary biliary cholangitis are predominantly diseases that affect women. Like
yeah,
80% of patients are women and 20% or less are men.
yeah.
Nobody really knows why there is that predisposition based on gender, but it's true.
When the specialist came out from Toronto, he said that I've found this amongst many of the First Nations women on the coast. I took it that he meant the coast of British Columbia, but yeah, he was saying that because of your lack of seafood in your diet or the change of diet, the lack of seafood is, he said, it's one of the main causes of this. Is that true today?
Um, I don't think anybody knows the answer.
Oh yeah.
Uh, I mean, one of the thoughts is that there's some infection which may be waterborne or maybe just even a simple flu-like illness that passes that causes the immune system to turn on, to basically activate it. So that is one of the hypothesis of autoimmune mediated diseases. And I have no doubt that that's probably what happens in liver disease because everything that you eat, every medication that you take, you swallow it, it goes into your stomach, it goes into your small bowel. The first organ that it hits, that the bloodstream hits after absorption of food and medications from the small bowel is actually the liver.
Mhm.
So it would kind of make sense to me that an infection that is from, eating something in the environment or maybe having something that wasn't very good that made you sick, that it would actually stimulate an attack of the immune system within the liver. I mean, that makes perfect sense. Whether it's due to nutritional deficiencies, I don't think we know the answer.
Well, I just it makes me wonder when this happened to my sister, why isn't this a kind of a well-known thing amongst the medical community? You know, we were spent years going from doctor to doctor with my sister, and they were unable to find the cause of her liver failing. I just wonder what could be improved with our healthcare system to stop these things from happening or prevent them.
Medicine was pretty primitive not too long ago, to be completely honest with you, Mr. Pelkey. I think in
Yeah,
the 1990s and 1980s, and maybe even into the 2000s, most doctors really didn't know much about liver disease at all. Well, I mean, whatever they learned maybe was a stereotype of alcohol causes all liver diseases, or some erroneous kind of stuff. And it wasn't quite well known amongst the medical community unless you're a specialist. And even then, the amount of knowledge we had as specialists was limited back in those days. It really wasn't well known. And I think it was probably just ignorance.
mm, mm. Yeah. So I guess more of this knowledge needs to be put into the healthcare system, and in order to learn more about these things, make it more preventable and how it affects our First Nations women. After losing my
Yes.
sister, finding out that a lot of other women in our First Nations are affected by this and don't know why they are.
Before 2000, it really wasn't known that the indigenous community of British Columbia had a lot of autoimmune liver disease, like autoimmune hepatitis and primary biliary cholangitis. Like
Yeah,
it really wasn't known at all. And then um,
yeah,
I started looking at this and publishing some papers and publishing papers with other people, with a geneticist named Laura Arbor. And suddenly people started to realize that this was actually true. And we kind of changed medical culture. I'm proud to say this. And I'll be honest with you, back in the day, I think that when a lot of doctors saw somebody of an indigenous background with liver disease, they automatically jumped to the conclusion it was probably alcohol.
yeah,
But we changed the culture, and now what they do is they make sure that the patient doesn't have autoimmune liver disease, PBC, autoimmune hepatitis.
yeah,
So we've made some very positive contributions to the medical culture and medical education. So
mm,
I think the level of awareness right now is actually way better than it was in the 1990s and before. So
yeah,
that is something I'm personally proud of.
yeah, yeah. Yeah, I'm glad to hear that myself.
But thank
That
you.
the word is getting out there, and from your work, and that shows that people should look deeper into the situations that they find, not assume that everything is related to alcoholism, you know, because that's how we feel when we know one of our women go into this. Do you know of any research, other research is into this in regard to is seafood or what benefits there are?
There is a lot of research into what is now the growing tsunami of liver disease called non-alcoholic fatty liver disease, where basically things like seafood and fish are very good, healthy, and things like carbohydrates like rice, noodles, bread, potatoes are kind of not so good.
Mm-hmm.
So there's a lot of research into that, and I think in terms of non-alcoholic fatty liver disease, I think a seafood diet is actually probably the best.
Mm-hmm. That's kind of half of our battle is trying to bring back our traditional foods and you know our people that live here, especially in the Saanich Nation, we were known as the saltwater people and primarily lived off of the sea and various forms of seafood. And so, with the introduction of modern foods into our diet there, that really we feel created a very unhealthy lifestyle and situation amongst our people. So are really trying to encourage going back to seafood.
I strongly agree with that. Traditional Japanese diet is mostly seafood,
Yeah.
and Japanese apparently, at least I've been told, have the longest lifespan of almost anybody on the planet.
Hmm. Yeah. 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 I've been there and I've seen their seafood markets, and it's just incredible the amount of things that can be eaten from the ocean in different forms. So for us here is getting back out there, I guess, and but I guess the other thing is the environmental effects of
Yes,
ecosystems. These, is degrading, and seafood is becoming more scarce. So, a real need for that, but a real lack of availability, I guess.
I agree. I agree completely.
Well, I hope that people are going to hear this from you, science behind this, and what the real causes of are, because it's still a relatively unknown thing amongst our people, the First Nations people, and it feels like it amongst the medical community to change
Yes,
that.
yes, definitely.
I really want to thank you for meeting with me today. I think I really appreciate that, and we'll hope that a lot of people are able to learn from you, and so I'm thanking you.
Well, Mr. Pelkey, it's been a real honor and for me to talk with you as well.
Thank you.
Thank you.